Welcome back. Now we're going to talk about roles of a nurse. There are many roles of a nurse, so we're going to talk about many of them. So nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. Important qualities for nurses. We talked about critical thinking in the last unit. The nurses need to have critical thinking skills. They need to be caring and compassionate, detail-oriented, have organizational skills, have good speaking skills, even better listening skills, have patience, and be competent in what they're doing. So, roles and functions of the nurse. We're going to go through each one of these individually. You can look at these. You actually do not have these in your current book, but we will go through each one of these individually. So the nurse is a direct care provider, addressing the physical, emotional, social, and spiritual needs of the patient. Examples: listening to lung sounds, doing an assessment, giving medications, teaching patients. Communicator, using interpersonal and therapeutic communication skills to address the needs of the client, to facilitate communication in the healthcare team, and to advise the community about health promotion and disease prevention. A nurse should be a great communicator. Some examples again: counseling a patient, discussing staffing needs at a unit meeting, providing HIV/AIDS education at a local school. So again, these are just some examples. Patient family educator, assessing and diagnosing the teaching needs of the patient, a group, a family, or community. Once the diagnosis is made, nurses plan how to meet needs, implement the teaching plan, and evaluate its effectiveness. Some examples of educator include when we do preoperative teaching, when we do education for siblings or for new parents or to be new parents on the maternity unit, community classes on nutrition. Patient advocate. In this role, we support clients' rights to make healthcare decisions when they're able to voice their opinions, and protecting clients from harm when they are unable to make decisions. So we provide advocacy. So one of the examples is when we help a patient explain to his family that he does not want to have further chemotherapy. Some family members want to say, oh, mom or dad, but you have to live for us. But maybe that patient does not want any further treatments. So we have to advocate for our patients and what they want. Sometimes we play the role of counselor when we use therapeutic communication skills to advise patients about health-related issues. One example is counseling a patient on weight loss strategies. Many times nurses are change agents And in this way, we function to advocate for change on an individual, family, group, community, or societal level that enhances health. A nurse may use counseling, communication, and educator skills to accomplish this change. So one way we can be a change agent is working to improve the nutritional quality of a school lunch program. Leader is another role nurses can play. Inspiring others by setting an example of positive health, assertive communication, and willingness to improve. Examples of leaders. Florence Nightingale was a leader and basically began the profession of nursing. Martin Luther King Jr. was a leader for the civil rights movement and made many strides toward equal rights for people. Another role might be a manager, coordinating and managing the activities of team members. An example would be a charge nurse on a hospital unit. Case manager coordinates the care delivered to a patient by many health team members and by many services, and finding resources for people so that their health care needs are met. So an example of a case manager would be a coordinator of services for patients with any number of chronic health problems, and again, getting them resources through Medicaid or Medicare, because let's say a transportation issue, they can't get to the doctor's office for an appointment, so the nurse tries to find a way to get that patient to the doctor's office. Finding resources and coordinating care is the role of the case manager. Research consumer. Consumers of research. We apply evidence-based practice to provide the most appropriate care, to identify clinical problems that warrant research, and protect the rights of people who decide they are going to be research subjects. So one ways, or several ways, that we are research consumers is by reading journal articles, and we attend conferences seeking additional education and continuing education units. What will your role be when you become a nurse? I can imagine that most of you will fall into almost every single one of those roles at one time or another throughout your career. I can honestly say that I have had each one of those roles during my time in nursing. So something else that this unit covers is the Nursing Code of Ethics. So what are professional codes of ethics? Professional codes of ethics tell us, what is right and what is wrong. What should we be doing in our profession? So the code of ethics are formal statements of a group, and this doesn't just include nursing. Many professions have codes of ethics. But it's a formal statement of a group's expectations and standards for professional behavior for that group. Within the group, it sets forth ideal behaviors from the individuals in the group. The Code of Ethics for a group is only as effective as the behaviors of the nurses who live up to the codes. So the Code of Ethics for nurses is only as good as the people who live up to the code. So purposes of the Code of Ethics: inform the public about the profession's minimum standards, demonstrate nursing's commitment to the public it serves, outlines major ethical considerations of nursing, provides general guidelines for professional behavior, guides the profession's self-regulating functions, and it reminds us of the special responsibility we assume in caring for the sick. Just so you know that the Code of Ethics is not legally binding, but the Code of Ethics often exceeds legal obligations. The state boards of nursing, and of course we're in Missouri, so our Missouri State Board of Nursing uses the Nursing Code of Ethics as a standard against which to evaluate a nurse's ethical behavior. The board has legal authority to censure or reprimand the nurse who does not practice within the boundaries of ethical practice. So if someone reports a nurse as doing something wrong, disciplinary action may ensue, and the nurse may get her license censured, revoked, any number. There's several different levels of reprimand for nurses in the state of Missouri. So we have a very large disciplinary budget, unfortunately, in the state of Missouri. So the American Nurses Association Code of Ethics for Nurses has 9 provisions, and I'm just going to read each one of them to you. Provision 1. The nurse, in all professional relationships, practices with compassion and respect for the inherent dignity, worth, and uniqueness of every individual, unrestricted by considerations of social or economic status, personal attributes, or the nature of health problems. Provision 2. The nurse's primary commitment is to the patient, whether an individual, family, group, or community. Provision 3. The nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. Provision 4. The nurse is responsible and accountable for individual nursing practice and determines the appropriate delegation of tasks consistent with the nurse's obligation to provide optimum patient care. So what is that telling you? It says appropriate delegation. So when you get into nursing school, many of the questions that we ask on exams directly correlate with this provision. We want to know how you will delegate a job, or if you will delegate a job to someone else. What things can you delegate? What things can you not? Because there are definitely things that you should not be delegating to other people, like personnel who are, let's say, nurse assistants who don't have the skills that an RN does, or even a licensed practical nurse who does not have, let's say, the assessment skills that somebody with a bachelor's degree in nursing has. So what can you delegate and what can you not? Provision 5. The nurse owes the same duties to self as to others, including the responsibility to preserve integrity and safety, to maintain competence, and to continue personal and professional growth. So they are telling you that you need to be a lifelong learner and continue to learn throughout your career. Just because you go get a job doesn't mean you're finished learning. Things happen every single day that are new and different. We've always got new medications, we've got new technology almost on a daily basis. So you have to be able to, in some fashion, keep up with the new things coming out. Provision 6. The nurse participates in establishing, maintaining, and improving healthcare environments and conditions of employment conducive to the provision of quality healthcare and consistent with the values of the profession through individual and collective action. Provision 7. The nurse participates in the advancement of the profession through contributions to practice, education, administration, and knowledge development. Provision 8. The nurse collaborates with other health professionals and the public in promoting community, national, and international efforts to meet health needs. Provision 9. The profession of nursing, as represented by associations and their members, is responsible for articulating nursing values, for maintaining the integrity of the profession and its practice, and for shaping social policy. That is the epitome of being a leader. So this is the end of the unit on professionalism. Thank you very much for listening.